And I'd like to take a chance to walk through, especially for parents who are nervous right now, about what the steps are that we're taking in New York. So getting colder outside. Half my staff was out sick last week. It's respiratory season, respiratory viral spread. And we're all seeing these, again, the national news stories, and it's concerning. You know, it's the flu, it's COVID, it's RSV, all at the same time. So you're asking, if my child gets sick, will I know the symptoms? What do I do? How can I protect my family? I'm a parent. Now I'm a grandparent, and I'm constantly calling about a 6-month-old baby saying, are you watching out for these symptoms? So I know what parents are going through. There's nothing to be alarmed about right now. What you've seen in other states is a reaching capacity in some of the hospitals, especially pediatric units. And I want you to know our Department of Health is laser focused on all the dynamics involved. You know, do they have enough nurses available? Do they have enough hospital beds? Do they have enough ventilators? So I want everyone to know that we are focused on this intensely. We have a couple areas of the state that have had a problem really for the last couple of years. The Finger Lakes in central New York, it's below 10%, but they have historically had fewer beds, and they've proactively been able to manage when the numbers start increasing. And again, we're always ready there to deploy people from one part of the state to the other. It's something we've done very well for a number of years. So we'll be able to manage that. Right now, statewide pediatric beds, non-ICU capacity is 25%. And again, in those areas, it's about 10% that I mentioned. So 25% non-ICU pediatric beds are available. But we'll track the data. And if we see any alarm bells, we'll know early enough so you know if something happens to your child, because we've seen these images on television. You know, tiny babies on respirators struggling because they contracted this illness. And I know what that does to parents when you see that. So I want you to know here in New York, it's not here. We're in good shape. But we are ready in case those circumstances change when you see just neighboring states going through what we're trying to avoid here. So we'll talk about what we're going to keep doing. I want to talk about best defense for all of us right now is a flu shot. I will be subjecting my arm to a flu shot momentarily, and you all can watch. And I promise I will not grimace. I practice not grimacing in front of you. So let's get it done. I mean, it's just the easiest thing you could do. Just get a flu shot. I will get mine now. Some wait to the dead of winter, but it's hitting earlier than normal right now. So don't wait for December, January, February. It's too late. You could have protected yourself. So it's starting earlier. Right now, as of Monday, over 3 million New Yorkers have already had their flu shots. That's good, but our population is a little bit bigger than 3 million, so it's as easy as calling your doctor, walking into any pharmacy. And my other question is, how's our flu shot supply? Do we have enough shots available? And I'm assured by everybody, I'm always asking about our numbers, that we have more than enough, because there's enough facilities that manufacture the flu vaccine. And unlike what we saw with COVID in the early months, there just weren't enough people manufacturing it. So we're in a good shape there. So let's talk about exactly what RSV is. These are the symptoms. I want parents to be aware of them. Usually fall and winter. It's like a common cold, but it does hit younger children, and it's really frightening. It's not new at all. Something we've seen before, but you know, infants as young as 6 months old have been known to contract this. So you know, it's hard to keep kids safe. You know, think about the fact that a year ago, before a year ago, a lot of kids were wearing masks in a daycare center or in schools, and that did give them some level of protection. We're not mandating this, but we're saying, parents, you got other kids, you got kids in school, preschool, and you got a baby at home. You really might just want to take these extra precautions. And by now, kids are more socialized to the idea of wearing a mask. It's not as strange to them. It's not as like, what is this all about? There's really cute masks out there. I've seen a lot of them. So that's something I'm encouraging all parents to consider for their children right now. And we're talking about how we can stop this spread. Right now, the spread of RSV in New York State is no different than previous years. So I'm really not being an alarmist. I'm just trying to be proactive here. And so we're going to stay in touch with our local health departments constantly to see if they're seeing any spikes or any trends that we should be aware of, and we'll keep watching that as well. We're launching a public awareness campaign so parents know the symptoms, what to do, and how they can keep their kids safe. And these are the symptoms: fever, cough, stuffy nose, decreased appetite. And again, we have frequently asked questions on our website as well, so I want to make sure you know all about that. So RSV services for healthcare are fully covered by insurance companies as well, so that includes testing and treatment. And if you have any coverage issues, let us know. If someone tells you it's not coverage, our Department of Financial Services will help take care of that. You can file a complaint. Also, we've never taken our eyes off of COVID. We announced our fall action plan back on July 20th. Many of you joined us. We talked about exactly the strategies we are taking, because what we've learned about this pandemic is you just never can tell. This time last year, we were going through Delta. Never saw Omicron on the horizon until November 26th, and then it hit us harder than anywhere else. So we're always watching, but again, just to give everybody an update, the last time we gave an update was about 2 months ago. I want to, on a regular schedule every couple of months, make sure everyone knows what we're up to. So we had our back-to-school plan on August 22nd, talking about keeping our kids safely in schools, encouraging people to stay home if they feel sick, always get tested. It's the easiest thing to do. We are right now stockpiling everything you need to be able to deal with this, so we're ready again for the fall surge. Coordinating with our federal and state partners as new variants are on the horizon. We're going to keep our eyes on those as well. So I'll tell you about some numbers where we are. Still, that's still a positive sign. Remember, it was November to February. It was a frightening time here. Look at the spike in those numbers. Our peak was 90,000 cases, 90,000 over a 7-day average. We're at about 3,400 right now, so a dramatic decrease in that. We had 17 per 7-day average per 100,000 is 17 now. At one time it was 366. Hospitalizations are down to about 2,700, down from 10,000. We learned a lot of lessons about making sure our hospitals could handle the capacity. And our deaths for 7-day average are still, people are dying every day from COVID. It is not over. About 34 deaths just yesterday, and our hearts go out to their families of people who probably never expected this to happen, especially as we approach the holidays. So hospitalizations and deaths are stable, but COVID is still a threat. But now we have the new vaccine. The bivalent booster is especially effective against Omicron, because here's what I have to make sure people don't think. If you got your shot, you got your booster a while back, I got it last year, I'm all good. No. You need to get it updated, because this is specially tailored to the variants that are out there right now. They were not there before. This is designed to be able to be stronger for you. So we're really encouraging people to just get their updates. I got mine on September 7th, feeling great. And also anyone over 5 is eligible to get this now. That's a new development. So if you have a 5-year-old, get them in to get a booster, especially when they're sitting in a classroom with so many other kids. Kids aren't wearing masks as much. They're playing together. Please help to stop this spread in your own home. And I would say that you don't have to worry about supply of that either. We're checking on how we are doing. We have enough doses for more than 20% right now, and only 7% of people have taken advantage of it. So there's plenty out there. So what are you waiting for? I just want to, the media, I appreciate you coming out there and helping us spread the news about this, because I know, again, it's frightening if you are watching the news. Is that coming? Are my babies safe? Are my kids safe? And I just want you to know how seriously we're taking this. And we know that COVID is going to be with us in the long term. The flu is going to continue being with us. RSV is going to pop up, but when you have the convergence of all three at the same time, it does create pressure on certain healthcare systems. But here in the state of New York, we are in a very good place. So everyone does their part, gets their flu shot, make sure their children are protected, practice good hygiene, stay safe during the winter, and we are always here to help. I also have Dr. Mary Bassett, who will be ready to answer some questions. But before I get to the questions, I think I'll do what I have to do here. Nurse Marie's going to take care of me? All right. You seem very chipper. What you're about to do to me?
I love this. This is my thing. So you promise not to grimace.
No, I don't.
If you don't grimace, you will get a lollipop. All right? So I'm going to wipe the area down first. And it's just going to be a little pinch. Okay.
Let me know when you're going to do it.
You're all set. Perfect. Oh, no, you have to get your Band-Aid. Your cute Crayola Band-Aid.
I was going to do this yesterday.
Perfect.
I thought better of it for last night.
And then you'll zip up. Here you go. And you're all set.
This made it all worth it.
There you go.
Thank you for coming over from CVS. And
Of course.
CVS has been an amazing partner throughout this whole process. As have all of our pharmacies. So I have the pleasure of having the finest Commissioner of Health in our nation, Dr. Mary Bassett, on with us right now, who'll be happy to answer any of your questions. Dr. Bassett, anything I left out in my quick overview of what we're dealing with the triple threat and how we're handling it?
No, Governor, you did a really great job. I just would note that RSV is something that we see every season. For this year and last year, we are seeing cases earlier, and we're also seeing an early flu season. And we all anticipated that we would see rising rates as the winter months approach. We both have people indoors now, and we have fewer people wearing masks and more people going out and socializing. So the rise in infections, respiratory infections, was anticipated. What we have to protect ourselves with are also things that we've anticipated, reminding people of good hygiene, respiratory hygiene, cover the cough, wash your hands, keep children and yourself home when you're sick. And of course, Governor, as you've indicated, we do have vaccines for influenza and for COVID, and we need people to get their shots.
All right. Thank you, Dr. Bassett. Any on-topic questions for myself or Dr. Bassett first? Yes.
Hi. A judge in Staten Island released an opinion yesterday in favor of sanitation workers who said that they were wrongly let go because they refused to get vaccinated. The city is appealing. I'm wondering what you think of the mayor upholding the municipal vaccine mandate while yesterday the city health department got rid of the private sector mandate.
I'm not going to second guess how the mayor is handling the situation. I will say that we did have a mandate in place for healthcare workers in the state of New York. That's the area where I had jurisdiction last year, and I'm glad we put that in place. You know, a lot of people had questions about that, but to think that your child going into a hospital or your parent going to a nursing home would be attended to by someone who would actually give them the COVID virus was not something that we would support. So we want to make sure that our healthcare workers are vaccinated, and that the mayor's made his decisions with respect to his his workforce overall, and I respect his decisions.
Any other on-topics for the governor or Dr. Bassett?
All right, Dr. Bassett, you're discharged. All right, carry on. Right,
Thank you.
Thank you. All right.
Go ahead, Melissa. Go ahead.
Governor, looking back on the legislative session, it seems like a lot of the bills and a lot of the debate were designed to help people who've been convicted of crimes. And I'll give you an example. In September, you signed a bill that changes the name from inmate to incarcerated persons. Do you really think that's the top priority for most New Yorkers? And what kind of message does it send about democratic priorities?
I'm not sure where that was considered a top priority of ours, given that I don't recall even doing a press conference on that. I don't think, it's just one of those issues that came to the legislature. I received this year actually about 1,007 bills to consider, so it's important for the legislators. It doesn't have a real effect. It's a naming situation, and I'm not sure how that takes away from what has been nothing but a nonstop concerted effort to keep New Yorkers safe. Starting with our efforts in January, when I convened, and this is when I talked about it, had our first ever in the nation, 9 states working together. Never did this before, sharing data on tracing illegal guns coming here. That's how you get 9,000, almost 9,000 now, 8,000 guns off the streets, because you have the state working with other states, working with the city. Changing the bail laws. We did that. There was a lot of controversy around that. That's why our budget was not 1 day late. I would have loved an on-time budget this year. It went 9 days late because I said I insist that we make these changes before we leave for the session. Right after the massacre in Buffalo, came back more intensely important gun safety laws, including saying that 18 and 19-year-olds and 20-year-olds shouldn't be able to walk into a store and buy an AR-15. Just as a child and a teacher were slaughtered in a school in St. Louis a couple of days ago. The insanity continues with respect to guns. But even in January, you're in the subways with the mayor. Last January, standing with him, talking about how I'm going to support his efforts to make them safer, dealing with the mental health side of it, supporting him, and we were there again. So I think when it's so easy to take like, oh, you signed this bill, therefore this, I don't think that's a fair characterization of a very lengthy record, and I'd be really happy to share with you about 15 straight pages of single print data on what we've done to fight crime. It's what I've always done. It is not a campaign issue that we woke up to. It is something I've been talking about and focused on. And whether the rest of the world's, the media focus has been there sustained, that's not for me to determine.
Governor, you know, following last night's debate and through the entire campaign, your opponent has made crime a central focus of this campaign. And while you have been able to show that you have done many, many things since you took office, the bottom line is that people still don't feel safe. People still are afraid to take the subway. The fear is palpable. People are afraid to walk the streets. So the question is, what do you think you can accomplish, new things that you can accomplish as governor that will change the fear, that will be the deciding denominator, that will make people feel that this is the safest city in the world, the safest state in the world, because they don't think that right now.
Now, and that is very real, and this is what is deeply disturbing to me. You know, it's what I think about when I go to bed at night, is how we can make people in this city, in this state, feel safer. I know that telling them that statistically we are the safest big city in America. When people say they're going to leave, well, you're not going to Atlanta, Chicago, Washington, even Seattle, San Francisco for sure. I mean, but historically we're better. But that doesn't do anything to anyone. I can't change a feeling with a statistic because it's real. And I accept that. And I want to be the person who can help lead them to a place where they have that sense of security. So what do? We say, you feel safer with the presence of more police officers? Then I'll help you. You would not have heard this before in the past, where the state of New York is deploying our state workers to help in the cities and also in our subways. We're doing this in Rochester and Syracuse as well. They needed more help. State police are there. New York City needs help. We have our support from our NTA Transit as well as state police doing whatever we can. So it's that. It's also resources. You know, tripling the amount of money for law enforcement is what we did in our budget. That's on the line out there. But also letting people know that there's cameras out there. When you're on a subway and you're getting nervous about something, you need to know that over time, every single train is going to have 2 cameras watching everything that goes on. And also, I know how frightening it is when people see someone who has a severe mental illness. They could erupt at any time. You know, they could have an episode, and they could cause harm to you or your loved ones. That is frightening. So we've been working on this since January. There's over 2,400 individuals who've had connections made to help get them to treatment. But also, we need to have long-term beds because they're just cycling back into the system. That's why we, very quickly said we can identify that, they're the most frequent riders, I would say, the people who are there persistently. We know who they are. We can get them because we now have the laws as part of our bail laws. We strengthened Kendra's law, and judges have abilities to have court-ordered treatment for people who really are severely ill, who could harm others. And the other part is that, keeping guns out of the hands with people with mental health problems. So I can tell people all this. I don't know what it takes then for them to say, I feel better, as long as they're going to continue reading about the stories that have always been part of our history, always. But I'm going to keep focusing on it. I'm not giving up on this. I want people to feel safer in this city.
Here's the question. Do you think if you were able to get the legislature to add the standard of dangerousness to the bail laws, that this would silence the critics and it would make people feel somehow safer on the streets of New York? Do you think that may be the missing secret sauce?
Let me ask, did they feel safer before the bail laws were changed? Because I want everyone to understand, we've never had a dangerousness standard. The Republican governor and Republican legislature that did the changes to the criminal justice system and to our penal laws back in the 60s and 70s, we've never had a dangerousness standard. I think there's just a mischaracterization that there was once a dangerousness standard and then it was taken out. That didn't happen. And what I did in our bail changes, I put in more standards for judges to consider than they had before. I said you have to look at, was an order of protection violated? Is it a repeat offender? Everybody talks about the repeat offenders. That's why I focused and had to fight hard to get that language in the bail changes. Anything related to a gun offense, even if it's unloaded. So I just want people to know that. I think if they understood, well, you never had it, you felt safer before, so you really can't let it all be distilled down to this one thing that will make people feel better. And it's frustrating because I want it to work. I want people to have that sense of security that they all deserve. I'm going to keep finding every way. I have constant meetings with my staff. What else can we be doing? Who else can we help? This has been my top priority. It has been my top priority as governor for the last 14 months.
Melissa, go ahead.
It's a two-part question, Governor. Thank you. Good morning.
Good
So
morning.
you talked about, you're thinking about everything you can possibly do. How much of the responsibility for bringing down crime really is of the governors as opposed to the local police departments? And then separately, you mentioned the mentally ill and moving them off the subways, off the streets, and into treatment. The biggest problem historically has been that, they get brought in and then they're released within 24 hours because they don't meet the standard for dangerousness. I know you mentioned Kendra's Law, but part of what your own administration said they would do is to get the hospitals, the psych clinics to reinterpret the law so that dangerousness or the risk of harm didn't have they might be at risk of harming themselves. It doesn't necessarily have to mean that they're about to do something criminal. So how are you changing that piece of it so that people are actually held long enough to get proper treatment?
No, exactly, and that's where there was a failure before. And that's why we're saying it's not that you have to look like you're someone who's going to be getting a gun or someone who, on the edge of the subway station, just ready to push someone in. You don't. It's not what's required. It is a lesser standard, but one I think that's going to be more effective in dealing with the problem, which is if you truly cannot take care of yourself, if you are walking around and you have no, demonstrated not a capability to take care of your own self, basically, your example, walking around without shoes in the wintertime, that's showing that you're not capable of making correct decisions. Now, does that mean that you're going to harm somebody? No, but it also says that can society trust that as well? And we have a right to protect ourselves as a society. So we have created an opportunity for this assessment to go on, which is broader than it had been in the past. And the test isn't dangerousness. That's what people are saying, they want to see in the bail laws, which we never had before anyhow. So we have worked with our mental health professionals. We're actually retraining the law enforcement too, training the police so they know what the law changes are, so they know what the ability they have to, to move people along, get to know a better place, what their rights are. So it's a re-education because the status quo went on a long time, and now we have to get people to start thinking about, but we have to protect people from others who could do them harm. So that's in place and needs to be,
Are the doctors who have to make that decision in the hospitals about whether or not to involuntarily hold somebody against their will? Is that happening more?
That's what we're expecting, yes. We're having those communications. We want to see that. We absolutely want to see it. That is the result that is intended from the changes we made. But it's also, are there enough beds to put them in? And that's one of the reasons why, as part of our changes last year to address this, it's a holistic approach. Are there enough beds? I asked the question, where are all the beds? Well, it turns out there is a disparity between reimbursement for psychiatric beds because they're more expensive. You have to have a psychiatric nurse, a psychiatric doctor, versus a non-psychiatric patient. And because of that, there was a financial disincentive for hospitals to have more psychiatric beds available. So I peeled back to this. I talked to the budget team. I said, can't we shrink that disparity? Can we put more money behind this so there's not a disincentive? We did that. We're told that should liberate over 1,000 new beds, in addition to the 50 beds that we're actually creating in a new space immediately. So it's a complicated question. There's not one answer, but there's not one area that I have not pushed into and saying, can we do better there? Your question about whether a governor is actually supposed to be responsible for local policing, I think it becomes an issue in certain environments, certain times of the year. But historically, no, a governor would not normally be, but I've never defined any role I've had as the narrow confines of it. When people need my help, I'm there. That's why we are in the streets of Rochester. That's why we're in the streets of Syracuse. That's why we're in the streets of New York. With anything I have at my disposal, and again, New York State Police is about a fraction of the NYPD, but if they need more NYPD to police the stations and I can do the hubs, I'll do that. Because I don't care about titles, jurisdiction. Let's make people be safer and work together.
Governor, do you think that you won the debate? How do you think you did in the debate?
I feel good about how I did in the debate last night. I was able to show the incredible incredible differences of opinion on every issue that really matters to people, and including the issue we're talking about right now, is that there is no tough on crime strategy that does not include being tough on illegal guns. And you did not hear that last night from my opponent. Would not even say, would ban assault weapons from teenagers. That's how extreme it is, and I think people heard that last night if they have not seen it thus far. Last question.
Governor Hochul, my question is about women's health care. Lee Zeldin said he wouldn't outlaw abortion, but he hinted yesterday evening that he could curb funding for women traveling to New York for abortion. Is that evidence that he could, in fact, outlaw abortion in the state of New York?
You know where he could do it? He'd have the most power in a budget. That's something that has not been talked about, and he knows this. He's a legislator. And what I would just caution New Yorkers about, the people who were told when they were interviewing before a Senate confirmation hearing under oath that they would uphold the law of the land, which was Roe v. Wade, the appointees by Donald Trump, and you all heard Lee Zeldin defend his record last night, vigorous defense of Donald Trump's record last night. You saw what happened. They told people one thing, got the job, and the next thing you know, Roe v. Wade was overturned. So there is no trust of someone who now has this general campaign conversion and espousing views differently than they did just a few months ago when they were in search of the primary nomination and what they were telling supporters. So I would be very fearful of that scenario. And to say that the day after Roe v. Wade was overturned, nothing changed in New York, I said that's because I'm the governor. Nothing changed under this governor. I can't say what would happen under a different governor who has a 100% pro-life record and has been against women's rights his entire career. So I'll just leave it out there for the voters to dissect all that. All right, thanks, everybody.